Hello, my name's Michelle Bourne. I'm an occupational therapist working in mental health for over 15 years within older adults and individuals with a diagnosis of dementia. Recently, in April, I moved into the IDEAS team, which is interventions for dementia, education, assessment, and support. As part of that role, one of the big things that we look at is helping to reduce stress and distress behaviours with people with a diagnosis of dementia in care homes. An important factor of that, especially within my role, is looking at meaningful activities that can help to support individuals with a dementia. So we know that obviously people with dementia lose a lot of their abilities that they've had in life. So it's really important that they have meaningful activities that they can connect with, that can help them to exercise their brain, help with stimulation, help with social contact, and help with quality of life. We know that individuals with dementia who have access to activities that are important to them helps to reduce the stress and distress behaviours that they might otherwise experience if they were bored or they had nothing to do or they didn't feel a connection with anything. One of the difficulties recently, obviously, with COVID is the lack of social support. So, again, the importance of having meaningful occupation and having other ways to access social supports has been really important. So, as part of my role as the occupational therapist within the Ideas team, one of the things that I've tried to establish is a forum for all the activities coordinators within the care homes. The activities coordinators play a vital role in looking at activities and supports that can help individuals engage in things that they would like. And I think that's been especially difficult, obviously, because of a lot of the restrictions that have been put in place and the restrictions during COVID of having visitors or guest speakers or people coming in. So, one of the things that I was really keen to do was help to re-establish and create a forum for the activities coordinators, which we did via Teams. So, all of the care homes in Dumfries and Galloway were invited to join us via Teams and really just look at them being able to discuss any concerns that they've had, peer support for them, and to sharing best practice. We have had a good number of members attending that have felt it's really useful. It also gives them the ability to problem solve some of the difficulties that they've had in terms of having to do a lot more one-on-one activities. Another part of the network for myself has been helping to support them looking at COVID friendly activities and using virtual networks to allow support to do that. I know that one of the care homes that they won't mind me mentioning had a brilliant initiative, and they do themes every month for different countries. They use virtual forums with individuals in their room to the different countries, have themed menus, the staff dressed up, and the activities coordinator gave all the individuals in passports, which they stamp every month when they're going round to each individual. We have obviously now we're starting to see things relax, which is better. I think during the most difficult time of COVID, one of the other things was helping people to stay connected with their families, which again, with people with dementia who have difficulty with recall, it's really important that we help to maintain those links. So, using digital technology to be able to contact family was obviously another vital part of their role to help people stay connected. As things are now starting to relax, we're pleased to hear that visitors can now obviously go in, obviously with the protections to keep everybody safe. The care homes are really keen to share, the activities coordinators are really keen to share the different ideas and activities that they've been using within the forum. And I am keen that we establish meeting on a monthly basis. They've had really positive feedback from residents and family about the activities and the interventions, and the fact that they have helped to improve quality of life for individuals with dementia during this difficult time, giving them something meaningful and purposeful for them individually, and now socially distanced, moving back into groups so they can have a bit more social interaction. Also, as well as having the monthly meetings, if there's anything that they feel they need a bit of support with, or if there's any advice that they feel that I could offer or anybody else within the group, there is that forum to do that and to share ideas. I know that I can help to coordinate that. So one of the activities coordinators had sent a calendar of events of the year, which can be good in terms of helping to decide what to do on an activity that day. So it gives you a theme for doing things. So they were able to send that to me and I can distribute it. The activities coordinators themselves have got absolutely brilliant ideas. They've, faced a lot of difficulties and managed to keep going. I think it's so important, and we know it's so important, that individuals with dementia are able to still stay engaged, still do things that they enjoy, still use being able to think about things, and we know that that does help with not only quality of life, but will help them to stay more alert and engaged. So moving forward, it's continuing to keep up the links via Teams, which we've been doing virtually. Hopefully, the idea is that when things begin to relax more, we might be able to meet in person as well, probably within localities. I suppose the benefits of having the Teams meetings, though, means that all activity homes across the network of the area of Dumfries and Galloway have had the opportunity to all meet, which sometimes can be quite difficult with the geographics of the area. So I'm just really keen moving forward to help support them in any way I can, to highlight the good practice. One of the other things that we agreed was that we would showcase some of the work that the care homes are doing on our Ideas Facebook page, to share the really good practice and to help promote the great work that they're doing. So moving forward, that's what we're going to continue to do. And just any difficulties that they're having, any support that they need, looking at any kind of funding possibilities that are available, and really the benefits of the individual and just acknowledging the hard work that they have put into supporting all these individuals with dementia and the benefits that has demonstrated. So one of the other things that we've been looking at to help promote the great work that the activity coordinators that have been doing within the care homes is for them to have an opportunity to showcase their good work and excellent practice on our Facebook page. So I would really encourage you to come have a look at our Ideas Facebook page and see for yourself.